Hello and welcome to the Auditing Antics podcast. So today we did have another change in plans. The scheduled guest was not able to make it today, so we have Michelle back with us, which you're always a special guest here, Michelle, for sure.
I better be. I'm
I know.
special, but I don't know if it's in the same way the others are.
Yes. Now, today I really wanted to jump into something related to what I read yesterday. So, a couple days ago, CMS released, and if you're not aware of where a lot of these updates pop up, CMS does have a newsroom and they will put a lot of their, updates or things that they're looking into in there. And I was reading something that really surprised me related to skin substitutes. And I immediately had like this gut reaction based on what I was seeing that CMS thought um, the solution is going to be for this problem that definitely does exist. So I just want to read this really quick from CMS where they're talking about how they want to reduce waste for skin substitutes. And some of these numbers here were pretty alarming, and I wanted to focus on this first. So they're stating that they've had a lot of growth in this area, rising from 256 million in 2019 to over 10 billion in 2024, according to the Medicare claims data. And this is specifically talking about the increases in reimbursement or the increases in spending as it relates to skin substitute products. Now, one of the things that was concerning about this and what I had that gut reaction to is where they're talking about how right now, and again, this is just a proposal. So this doesn't mean things are set in stone. It doesn't mean we have actual definitive decisions. But this gives us a little glimpse into what we could potentially expect to come in the future. So the CMS is saying that a lot of these products are as high as $2,000 per square inch. And what they're proposing right now is that the skin substitutes will become an incident to supply and expected to essentially be wrapped into what is being done related to things like the application. So, Michelle, to me, this was really concerning because we know there's a lot of issues happening right now in the industry related to this topic. But once again, I'm noticing the solution that's really going to hit the provider. And
Mhm.
that's scary, it's concerning. The
Yeah,
other thing they said really quick is that it's not going to affect quality of care, timeliness of care, any
yes,
of these things. And it's funny that they say that as if they have any control over that when we
yeah.
know that just from a manufacturer's level, which we'll get into that. I want to get on a soapbox about that today for sure. But when we look at it from that level, we know that the problem doesn't exist just with the practitioners. It exists largely
No,
with the manufacturers and the
yes,
distributors and the people they have out there selling their, snake oil stories that
yes,
everyone just needs to agree to and use their products and bill it, and then it falls to the lap of the providers.
yeah, yeah. I think that it's what was what I kind of got a chuckle of is just like you were saying, like it's not going to impact your care or access to care. But then they're like, we're expecting to see a reduced spending of 90% on this product. And it's like
Yeah.
90%. Like,
Yeah,
that's
90%
insane.
out of how many billion?
Yeah,
Yeah.
well, the increase from the 256 million to 10 billion between 2019 and 2024. I mean, I could see why that raises some red flags for sure. Like, what has prompted this level of increase? So, definitely, like, something, just like anything when we talk about providers and being outliers and things like that. Like this is a prime example of something is definitely clearly an outlier that is a big standout in difference. And so that's what they're going to focus on and come up with a solution to reduce their spending on the product. So I just kind of I agree. I think it's kind of funny how they're like there will be no change in the service you receive. Well, yeah,
When the
okay.
dollars go away, the care
I
to
mean,
some extent is going to be affected to a large extent.
yeah. And the thing is it's really unfortunate because how many providers, especially like providers in things like wound care and stuff like that, that's not one of the more glamorous specialties to be part of. And a lot of them are there because they want to be. They
Yeah.
want to be in that particular specialty. And I know we have personal experience with seeing those specialties here in my household, and they really do care about their patients and their overall long term health. And I think a lot of like diabetic patients who
Hmm.
would use these things, and how is that going to impact their care. So it's just kind of one of those things. It's like, who wrote this article and did they read it back to themselves?
Yeah. Well, the scary thing is too is that they're just like, okay, well, we need to cut costs and this is how we're thinking it's going to be done. Do they even
Yeah.
understand the process? Do they understand a lot of the money and greed actually exists with manufacturers, and
Mm-hmm.
there's a middleman in a lot of this, which is a distributor, and I'll speak to that some today too. But a lot of the, I'll keep calling it greed, the money greed that we have existing that is driving these problems is not at the provider level. And
No.
to your point, Michelle, it makes me think about, I think it was last year, either beginning of this year, last year, I was working with vascular surgeons who were
Mm-hmm.
dealing with patients who had extremely complicated wounds. And it was one of those things where they are under investigation, and I'm working with the attorney. We're looking at documentation, all of the basics, medical necessity. What do the policies say? Did they follow the policy? What is the
Mm-hmm.
patient's progression? And, even when policies leave some deference to the treating practitioner, CMS and these different investigators still want to push, and they don't want to reimburse these services that are
Mm-hmm.
high dollar. But, as I'm sitting there talking with two of the surgeons, trying to dissect this all down from our side with coding and compliance, and then their side with compliance and clinical, if you look at the patients, first of all, as an individual human, to your point, Michelle, and look at what they're dealing with. This was not a one time wound that was not healing. The patients that needed these particular grafts had very large wounds, were continually being hospitalized at times due to the wounds, and they continued to progress. And, it was one of those things where the surgeon is asking, and rightfully so, what am I supposed to do? You tell me that I can try this one particular graph for this many applications, and then that's it. But this
Yeah.
patient still has a gaping open wound in whatever
Mm-hmm.
area of their body, and we're just supposed to leave it because your policy said they hit the magic number and we're done. And
Mm-hmm.
the sad thing is even in that situation, we had good documentation, we had strong rebuttals, we had clinical, we had compliance, we had coding, we had legal, still came back as a rejection. So we're still having to come back to the table. And this is
Mm-hmm.
for those patients that absolutely need it. So
Yeah.
that's the first thing my mind went to, is practitioners like that when we have wound care, plastics, vascular surgery,
Mm-hmm.
whatever specialty they exist in, and how that's truly going to impact their ability to treat patients. Especially
Yeah.
because, and again, we don't have a lot of information yet, and I'm going to keep an eye on this because I'm just so frustrated over it. But the way that that reads, and it says it's going to be incident two, Well, if we think about the application, for example, of skin grafting, that has its own rate attached to it, and that's dictated by a fee schedule from CMS. So, are they going to
Mhm.
raise the application rate to cover some of the cost of grafting? And we know these manufacturers aren't just going to want to be like, oh, we're losing our billions.
Yeah, and it also kind of rises the question in my mind as I'm, sitting here looking at these numbers. Like, what drove that level of increase in spending between 2019 and
I have thoughts
2024?
on it, and I've seen it.
So the there I'm just going to play devil's advocate here for a minute and kind of flip it over on those that we know are the bad actors and the bad apples in the bunch, where they know these things can be billed and they'll get paid for them. So they overuse it? Have they caused an overutilization problem? I just have to wonder, how did we get there? It's not probably only overutilization, but also manufacturers who just keep, raising the bar. So I kind of think, how did we get there? Like, that's a massive difference.
Well, and this is actually one place I want to pause and talk about this a little bit, because one of the things that is so frustrating when I do see non-compliance in a lot of areas related to, whether it's a biologic type
Hmm.
device, substance, whatever is being used, whatever the thing is, there's such a large push and drive from reps who come in there. They're a good salesman. They're going to push it. They act really confident. They tell you all of these things are correct. And they push a lot of these people into these situations. And I do want to recognize that at the base of all of this, some of what is really sad and frustrating is that when we have these products that get caught up in compliance and fraud, waste, and abuse, they do work really well. A lot of the times, this is what's coming into the industry, and it is making a difference in patients' overall health and healing and things
Hmm.
like that. So I don't want to downplay that side of it, but
No,
because of
not at
what
all.
yeah, and because of what I do and we do in the industry, I just feel obviously very passionate on the side of protecting our providers and our
Yes.
facilities who get sold these dreams and lies, and yet when they accept that, they're taking all of that risk, because we
Hmm.
have to remember that regardless of what Mr. John Smith rep from whatever manufacturer steps into your office and sells you, his name and NPI number is not going out on that claim. He's not the one receiving reimbursement for that service. And a lot of times when we have these investigations related to fraud, waste, and abuse, you've got to remember the way that they are identifying and quantifying this is on claims data. They want to know where the money is going for government based services. So, who's receiving that money? And then that's going to be a very large target of the investigations like we're seeing. All of that's leading to this news update we got on the 14th from CMS related to the skin substitutes. Now, I say all of that because another behavior we see a lot from manufacturers and distributors is once there is one area that something is covered, we're going to
Hmm.
see a massive increase, and they're going to go out there and they're going to say, oh, well, this is covered, just use this CPT code. But they're going to put in all of their public documents these little explanations that say, really, to cover their butt, it's your responsibility as the provider to look at Medicare's policies or payer
Hmm.
policy. And what they leave out of there is the fact that, okay, yeah, we've got, for example, when we look at amniotic based products or stem cell based products, anything like that, we have a little bit of coverage coming out now, but it is highly tied to things like a diabetic wound. And
Yes.
Michelle, I know I would like you to speak some to this situation too, because you had a family member that had surgery, and now all of a sudden surgeons are wanting to offer these home dressings. Oh, by the way, you just apply it yourself, but let's see if the insurance covers it and we'll go from there.
Well, most recently was last year. And I was actually really impressed with how this particular hospital and this particular orthopedic group handled it. So, my family member had had a hip replacement, and she was asking about this collagen dressing that she was supposed to get in the mail. And I said to her, I said, hang on a minute. I
Yeah,
said,
compliance red flags. Hold on, tell me
yeah,
more
and
about
and
this.
I said, you know what? This was before her surgery, and she said, yeah, about a week after surgery, I should get this dressing in the mail. I'm like, oh, that's interesting. So, going into the hospital that day, she asked about it. She was trying to check all her boxes, make sure we knew everything we were supposed to be expecting and all of that. And what they said to her was, we have to see if it's covered first. You will not just automatically receive this in the mail. This is something that we have to get approval for, and dependent upon your condition and how you heal, will depend on if this dressing arrives. And so I found it interesting because I'm sure there was somebody in the, initial talks and things like that, that was talking about these dressings and probably isn't familiar with the intricacies, but they actually did pull back and say, nope, these aren't just automatically going to be prescribed to you. And if it's something that we are able to get approved, you will receive it, and you will receive instructions on how to apply the dressing. In the end, she didn't need it. She never received it. But I was quite surprised at the turnaround of that, because I had just before that worked a project where I was checking medical necessity for these collagen dressings. And so I was like, oh, I don't think you're going to fall into that category. So I kind of prepared her for that, like, maybe this isn't going to arrive in the mail. And if you don't need it, but she wanted to make sure she was following all directions to a T, which, you can appreciate that. Because not all patients like to be diligent like that. But I was really impressed with how they handled it. But not every practice is going to be doing that. Like I said, I was doing a review not long before that of an actual practice that was sending them to everyone. And
Right.
everybody was just automatically getting the collagen dressing, regardless of whether it was compliant or not. So
Well,
I
and
was happy with that.
to speak some to the compliance side, so just so the listeners are aware, when we look at like an LCD policy, for example, from CMS related to the collagen dressings, there's specific things in there that talk about the fact that the patient is not progressing towards healing. So, right there, we have an issue where immediately after surgery, they want to use this dressing to help the overall healing of that patient.
Mhm.
Again, not saying at all that clinically it's not appropriate, that clinically that would not help that site heal faster. All of those things exist and are
Mhm.
true. But when we look to compliance and everything related to False Claims Act, all of these things, we've got to cover our bases. And, one other thing too, and I know every time I talk about new technology and things like that, I kind of give this little bit of a speech. So I've got to do it again here. We need to remember that when there is FDA approval, that doesn't mean that every single manufacturer who made a collagen dressing now has FDA approval. My guess is what happened based on that whole scenario you described is that a rep from the company who does have FDA approval went out selling their products and said, look it, we have approval, or Sometimes they only have clearance, which means the FDA
Mhm.
is just aware that they are going to start to market something. It does not mean it's approved, which does mean they cannot receive reimbursement for that most of the time. So all of these things happen in the background before we even get to the question of how do we apply a CMS LCD policy. So yes, what they did was really good as far as the different steps, but that's how
Mhm.
easy and quick it is to go down these paths because our
Yeah.
practitioners are really looking at the clinical piece. They're not looking at, oh, I've got these different stopgaps. Oh, we have
Yeah.
FDA approval. It must be fine. Things
And
like that.
it's going to be different across payer as well. I was just explaining that to somebody just yesterday that you can't expect your doctor to know what if this is going to be covered. Like, yeah, they're going to prescribe you this medication and you're going to go pick it up. It's going to be this whole thing because a different medication is what's covered than the one that they prescribed, and it's this whole ordeal. But there is no way for your provider to know sitting there in the room with you whether that is covered for you and your plan in particularly. So that's something that patients have to keep in mind when they are taking in this information and seeing what the possibilities are. But I forget where I was going with that. Yeah, they don't always know.
Yeah, informed decisions, and
Yeah.
that's the thing. How could you even make a decision about any of this when
Hmm.
you have no idea what exists in the background?
Yeah,
Now,
no.
one thing I also want to talk about related to the distributors, and I'm going to speak pretty generically here. But earlier this year, I was a part of a conversation and I wasn't involved in any projects or anything yet. But this person comes and basically says, oh, well, we have this whole thing set up and we have a manufacturer, but then we have 1099 distributors. And all this money is getting made in all of these different ways through distribution. And again, that's another reason that I have so much concern here because a lot of money does exist on that side of the industry. And when we have the reps come in, they're being pushed through this. And I actually had a situation come up last week. So one of the members in my coding compliance connection membership submitted a question and we had a conversation related to dural wrapping. So during spine surgery, when they have the nerve root exposed or the spinal cord in some way, this particular surgical practice started applying these amniotic based dural wrappings onto the cord, and they asked me about a specific CPT code, which was 15277. And I was like, okay, well, that does not work there. And, let's unpack this. Let's talk through what it is. Why is your client wanting to report this specific code and what's playing into the whole situation? So as we talk, come to find out, they have a certain rep. The rep is also a part of an organization that's been selling them other new spinal fixation equipment, which has such new technology to it. We don't have a CPT code for it, especially when it goes across multiple different spinal levels and segments and, the whole fun stuff with neurosurgery and spine surgery. So as we start to talk about it, I look up the code 15277 and I just looked it up again right now. And this is specific to the face, the scalp, the eyelids, mouth, neck, ears, orbits, genitalia, hands, feet, and or multiple digits. So could you tell me, Michelle, how that would apply to a spine surgery?
Yeah, I don't
And
see
this
it.
No, and the scary thing is, I mean, you would think that in the code combination, depending on the algorithms and the technology the payer is using, you would think it would stand out just based on the category or the
Yeah.
CPT code itself, that it's not in the same anatomic location. But that was, I say shocking, but I should never be shocked when I keep hearing these stories because it happens
Mhm.
all the time. But it was shocking because now we have a situation where this surgeon wants to continue to keep using it. And, even if we think about, having to repair the dura in surgery, usually that's not a primary procedure in itself. So when I started to get asked these questions, the first thing I said was, what is the indication in the operative report? Why does that have to be done? There really wasn't much context in the operative report as to why that was being applied. So, in discussions, we talked about how it's really like a preventative healing measure. So, again, I know it's frustrating, but payers don't like to pay for prevention. So, we have a lot of red flags there. And when I looked up the particular um, substitute, I guess we'll say, or graft that they're using,
Mhm.
it's not even FDA approved to be used in that way. So that rep is going around trying to sell it, saying, oh, it works for all these other things. And again, when you go to the base level, we don't even have approval for it to be used in that particular way. So there's a lot of concerning things. And this was caught because the billing company is on top of it. And I love that. We have our good friend Pam Vanderbilt on with us today, and she has her billing company like a lot of others do that I
Mhm.
know and am close with and know we can trust what they're doing. That shows again why that's so important because they're trying to be that safety net there, trying to give informed decisions and also mitigate their own risk as well. So
Yeah.
that, you know, again, there's just so much that goes into this that nobody's realizing, and then we still are dealing with practices who think that getting audits are just, completely unnecessary and they're going to be fine
Yeah.
and they're not going to be touched.
Well, when you become that person who has that ratio of 256 million to 10 million, they're going to notice you.
Yeah.
You will
Yeah.
automatically be an outlier, and I can guarantee you somebody's going to come knocking on your door about that.
Yeah. Yeah. And this is something, if you know that in your organization, if there is stem cell related products being used, amniotic fluid related products being used, or if you only know that there's grafting being done, you really have to be on top of this because even prior to this article coming out or this, news coming out, this has been a target. We've been dealing with this for over a year at this point where these services are getting looked at, targeted, attacked, money getting clawed back, all of those things. So, if you are in a hospital facility and you don't know what your different practices are doing, you need to go talking to these different specialties. Plastic surgery, if you have a specific wound care team. With vascular, it can be related to whoever's taking care of veins, pretty much. There's a lot of different places this can come up, but sometimes you're only going to go in and unearth that through conversations and making sure that you're aware of what's being
Mhm.
ordered, what's being used. And, another thing to think about, sometimes what happens is they'll look at the provider or the surgeon, but in the situation of the vascular surgeons I've been working with, they're private and they're going into a hospital facility. So they had a couple situations where, yeah, in the office they've got product they're using and stocking and all of that. But then in the facility, there's the stock that's being supplied by the facility. So there's a lot of different ways this really needs to be dug into and looked into. But this is something that really has to have a lot of attention tied to it because if you find out ultimately that reimbursement does not match the compliance side of things, then the question is why are they using that? And
Mhm.
that's the conversation I had last week with the billing company. They're using a new spine fixation device that requires an unlisted code because nothing else represents it. They're doing dural wrapping and they literally can get paid for nothing on that, which who knows what that hospital's billing it out as. So just another example, as always, of why external input is so important and you've really got to pay attention to what's coming out in the industry.
Yeah, and don't just listen blindly to the reps that are coming to your office. You know, if you're somebody who's responsible for meeting with these people and making these decisions, you have to make sure that after you talk to them, if it's something that you really want to move forward with, do your own research. You know, trust but
Get
verify.
your own
Never take their
consultant.
word. Yes, never take the person who's selling it, never take their word for it. They want to sell it and they're going to say things to sell it. You know, not that that's always the case, but I know you specifically have dealt with things where practices have just blindly taken the advice of the person selling the device or the, you know, whatever it is that they're selling, and it has resulted in a really big compliance
Mhm.
debacle is really no other word, because it's a massive disaster. And so you need to make sure that if you're having these conversations, do your own research about how you will be paid and what is required for you to be paid for these services, so that you can make a true informed decision about, is this right for your patients, for your practice.
Mhm. And it's really unfortunate because in a lot of times the projects I've had like that have resulted in situations that are pretty much going to cripple a practice because of all of the self-reporting. And a lot of
Mm-hmm.
times, I'll have conversations with the attorney who's representing the client, and they'll say, hey, at the time of due diligence, I talked to them about the fact that they need word other than the rep. Let's engage a consultant, all of that. They didn't want to do it. And then at this point, we're having to bring someone else in and we're looking at, okay, how much do
Mm-hmm.
you owe back now? And it's all of the services, most of the services, other things tied to what it was that you rendered. And one last thing I will say about that is when these companies send people out to you, representatives out to you, they will even sometimes send out physicians. There's a lot of them now that are coming over to that side and speaking. We know that they've always been speaking for these companies. You can look back in the
Mm-hmm.
drug industry and know that.
Yeah.
Um, but I've seen with devices and different things like that, apart from the pharmaceuticals, where they are starting to engage and send physicians out, and then other consultants who are quote unquote experts in the industry. So, like Michelle said, do not take their word, regardless of the credentials who, are being displayed in front of you.
Mm-hmm.
You have to do your research. You have to look into that yourself.
Yeah. I
Now,
mean,
go ahead.
you wouldn't, if you think about it from a standpoint, if this was something you were purchasing for yourself, you would do all of those steps. So just, you know,
Yeah,
do it for your facility too, because you will be impacted as well when this goes
yeah,
drastically south. Um, but yeah, it's very interesting. 90% less spending
yeah,
blows,
yeah. I know.
blows my mind.
I know. Well, and I do just want to remind everybody, I don't really push it as much on this particular platform of the podcast, but I do have a membership available. So I had mentioned the membership that the billing company reached out. And as a part of that membership, there is basically unlimited access to ask me as an expert different questions. In addition to that, I offer a lot of consulting services. So if it's something where you need, I'm not going to say full legal support. Obviously, that's not my space. I'm compliance and I work with attorneys, but I can help you navigate those things. I can help with the attorneys doing research, things like that. I will say I have multiple new clients coming coming in that are doing the hard work of this research up front. And I really do applaud them for that, because a lot of people don't see value in it and they want to just wait until it becomes necessary to defend themselves. And I've even begun working with one particular company that helps new devices coming out into the market. So it's been really refreshing from the compliance side to see that companies are recognizing how important this is going to be.
Hmm.
But if you have questions, in addition to auditing and all of those things, I'm definitely available to help in other ways. And we can look at what scenario you have and really break it down, make sure you're covering yourself. And believe me, it's going to be a lot easier. It's going to be a lot cheaper if we approach these things on the front end as opposed to the back end.
Yeah, and it's not always comfortable,
Yeah.
especially like the situation you said where the surgeon wants to continue doing what they were doing. However, it's not really feasible for them to continue doing that. Um, those conversations are not always fun to have, but it's 100% necessary to have them. It's unavoidable in that particular situation. So make sure that you're reviewing, like it kind of ties into what we talked about last week and the revenue cycle and knowing what's going on with your claims.
Hmm.
Start reviewing, seeing how, this, like you said, it's a proposed rule. So it's not final, but you do kind of have to do a little investigating to see what's the impact going to be if this does become a final rule.
Yeah.
So, even more, just to tie in last week's episode, even more important to be watching over your claims, how they're being paid, looking at your denials and things like that. Obviously, denials for things like this tend to stand out because of the dollar amount that
Yeah.
is associated with them. But there are, companies out there that they may be contracting that would just be write it off to make
Oh,
their,
yeah.
their numbers look good. So make sure you're having oversight in that, whether it's something that's being outsourced or being done in house, and start taking a look at what the potential impact could be.
And that's a good point as well. And with this, sometimes when I'm working with different organizations, the people I'm working with internally have the same thought process. They've done the proper research, they know the answer, but they're fighting against the surgeons, they're fighting against the CFO, and all of these other people who want to continue regardless of compliance. And, I've even been asked the question. Actually, a couple weeks ago, I was told, oh, well, we know compliance always wants it 100%, but in reality, what does it have to be? And it's like, okay, I didn't hear that person just say that. And maybe I need to leave this call because that was a ridiculous
Yeah,
question. But
100%.
I say
Always.
that. I know. I say that though because a lot of times they want to skirt the line and just wait to see if they're going to be found out, and they'll let the dollar signs take over the way a decision is going to be made, or how demanding a provider or a surgeon or physician is being. And we can't. We've talked about that on this podcast many times. There has to be balance. So if
Hmm.
you need that extra support in whatever way, reach out to me and I will be happy to help you with that. One last thing, if you could go over to our YouTube channel, it's stephanieallardconsulting.com. I am looking to grow that, add more content, all of those things. So please find us on YouTube, like that, subscribe, and stick along and, watch out for new content over there. Thanks, and we'll see you next week.